The biggest thing that sold me on this program was absolutely the people and the leadership. I remember when I interviewed here, I felt there was a sense of camaraderie within the residents who were talking to me on the interview. I remember one of the nurse leaders on my first day here said to me, "We will not let you fail." And that has held true through each and every single day that I've been here. The attendings, the nurses, the PAs, they all have that commitment towards you to make sure that not only do you not fail, but you also succeed and achieve 120% of your potential. And I think that's just very unique about this program.
Our emergency medicine residency program here at Geisinger is PGY1 through PGY3 ACGM accredited program. We have 9 residents a year that work throughout the hospital and the hospital system. Here in Danville, we have a large medical center that services a very large population area, and so the acuity and the medical conditions and the pathology that they get to see is pretty vast and not necessarily what you would experience in smaller community settings per se, but by training here they're able to take what they learn and what they do and apply that wherever they may go.
I would recommend anyone to interview with Geisinger for a variety of different reasons. I think the attendings are super approachable and really friendly here. They're very education focused. We work side by side with the attendings when we're on shifts. Our computers are right next to each other, so it's really easy to say, "Hey, I'm not quite sure about this patient. Can you kind of weigh in and kind of help me make a decision?" The other residents are really friendly. It's fun to be able to sit next to them and kind of run cases by them as well. I think our program has additional things that are really unique, like our Life Flight program, which it's pretty fun to be able to go into the scene calls, fly out, pick up a patient, stabilize them, and bring them to the emergency department.
We're one of a handful of programs in the country that truly integrate the residents into our flight program as part of the medical crew, rather than just a fly along. Our resident shifts on Life Flight are integrated into their emergency medicine schedule when they're on EM blocks, so that with the turns of the shifts, they'll do their ED shifts, we'll work in the PED shift, the community shift, the teaching resident shift, as well as the Life Flight shift. So it really gives a lot of variety to our resident schedule.
Emergency medicine is unique in that you can provide community care. You'll see anybody, the uninsured, the well-insured, anybody in between with any problem. I think that's a unique situation as a provider. You also have the opportunity to see everything. You're going to be a nephrologist at times, you're going to be a pulmonologist at times, critical care, orthopedist. So you play a unique role in that you're kind of wide array on what you see and treat. The reputation of Geisinger is second to none. Everybody in the community really trusts us here at Geisinger, and it's awesome to be able to provide care to a community that trusts you and respects and really cherishes kind of your care.
If you really love your medical education, if you love everything about what you've done in your training, you love surgery and you love cardiology and you love obstetrics and you love pediatrics, the amazing thing about emergency medicine is you get to live that and walk that every day, because you never know what's going to come through that door. For someone that really loves being a doctor, being an emergency medicine physician just makes it a worthwhile career, and it's really 30 years that you get to deliver to patients that really need you the most, and it's really rewarding, and I think that's the best part of the career.